Good morning. I hope you are doing well. Today I am going to discuss about Stein-Levanthal syndrome or polycystic ovary syndrome. This is very common, especially in the West, in the United Kingdom. 1 in 10 women has suffered from polycystic ovary syndrome, but it is extremely common in other countries as well. This is the cause of this disease is unknown and there is no cure. However, with treatment, the patient get some benefit. Stein-Levanthal syndrome or polycystic ovary syndrome is characterized by amenorrhea, lack of menstruation, or irregular menstruation. Patient does not have ovulation, so the patient cannot get pregnant. Patient has oily skin, darkening of the skin in some places, abnormal hair growth on the face, on the back, on the chest, and on the buttock. The patient is obese most of the time. However, obesity is not the absolute criteria for polycystic ovary syndrome. Polycystic ovary syndrome, the patient's pathogenesis of this syndrome is hyperinsulimia. When patient is obese, the patient produces a lot of insulin from her pancreas. This is hyperinsulinemia in turn cause excessive androgen production by ovaries and adrenal gland by the stimulation of hypothalamus, adrenal gland and the ovaries. Why it is called polycystic ovary syndrome? There are numerous small cysts which is 0.2 centimeter in size or 8 millimeter in size. These follicles are actually meant for ovulation in her reproductive life, but fail to ovulate. These small follicles contain some fluid which we call cyst, and that's why it is called polycystic ovary syndrome. There's multiple cysts in the follicle can make the ovary enlarge, which can be revealed by CT scan or pelvic ultrasound. The age limit of the patient is as little as 15 years and it can be up to 40 years. Polycystic ovary syndrome has a potential complication of metabolic syndrome, hypertension, atherosclerosis, heart attack, stroke, uterine cancer, sleep apnea, degenerative joint disease, and even depression due to poor self-esteem. But don't worry, you have to fight back. The treatment is your motivation. You have to stick to diet and exercise. American Diabetic Association and American Heart Association recommends you follow Mediterranean diet, NASH diet, a vegetarian diet, and at least 30 minutes of brisk walking every day, most of the days of the week. I would say maybe 7 days a week. If you can lose 5 to 10% of your weight, you will significantly be improved and your menstruation may restart and you may be fertile again. The treatment options are limited oral contraceptive and Metformin can help insulin resistance and hirsutism. Hirsutism is abnormal growth of hair on your face, on your back, on your chest and buttock. There is a thinning of hair and maybe baldness of hair as well. So this is fairly embarrassing situation for a woman. But I would like to encourage to raise your self-esteem by stick to diet and exercise every day and be optimistic, and your menstruation will come back and your menstruation will be regular, and maybe if you are married you will get pregnant eventually if you wish to. Doctors sometimes do laparoscopic drilling of your ovaries if medical treatment failed, if you want to get pregnant. I hope you have understood this short video. Please tune in and subscribe my channel, Dr. Atharosclerosis Khan, youtube.com. You have a wonderful day. See you soon. Thank you so much for your patience.